When you think about healthcare, now I suspect that probably the fastest growing expense you have here in this hospital is your own healthcare. And that's certainly the case with the federal government. Probably, Gene, I assume that's the fastest growing you guys. We haven't got it just right yet, and a lot of that is a function of trying to get more of universal coverage, so that we're not using the emergency rooms for so much of our treatment. And I think you're going to see an effort to look at some type of universal coverage, not a single payer plan. I think tomorrow you're going to see the Treasury roll out a much better way to use the last half of the so-called TARP dollars. I think we were all offended at the first part, the way that banks would take some of the money and give dividends or give bonuses or buy other banks. That was not the intention. We could just pay somebody to dig a hole and pay somebody else to fill it up, but that's not going to help us in the long term. What we need to look at is if we're going to make infrastructure type improvements, if we're going to hire people to do jobs, we need to hire them to do jobs that are going to move us into really to a 21st century. An example, healthcare IT is a part of that, and you'll see within this bill there is money for and grants for doctors and hospitals to be able to buy that software so they can get online, and with that, that's going to again make us more productive. There's going to be again, where we can dig a hole, or right now we need to expand our electric grid, and we need to also make it a smarter grid. Well, rather than just digging holes, we're going to hire people to expand those grids, which will allow us to put people to work and to have an infrastructure afterwards that will take us, so we don't have to come back in 2 years and do this thing again.